So good afternoon, everyone, and welcome. My name is Paula Rochon. I'm the Vice President of Research here at Women's College Hospital and the lead of the Women's Exchange, and I am delighted to welcome you to this event. So I'd like to begin by acknowledging the long history of the First Nations and Métis people in this land, and to recognize that Toronto was a sacred gathering place for many Indigenous peoples, most recently the Mississaugas of the New Credit. So that's something that we need to acknowledge and remember. So thank you all for being here today for this important discussion on an issue that I think really affects the lives of women and their families here locally, very much so, nationally and internationally. And Women's College here as a healthcare organization dedicated to advocating for and advancing the health of women and girls. In this organization, we spend a lot of time thinking about what makes women healthy and how to help them achieve their goals. We also spend a lot of time thinking about better ways to understand all the components that affect the health of women and how furthering our understanding of these factors through research and discussions like we're having today can really influence the delivery of health care. Earlier this year, our hospital launched a public awareness campaign about the health gaps that women face. I don't know if you've seen it. It's a beautiful campaign. If you go around the hospital, you'll see parts of it. And there's hard copies, and it's available also on the internet. One of the areas of focus of that campaign was on the social determinants of health, and so that's very relevant to our discussion today. So we know that factors like income, employment status, and housing all very much influence a person's risk for disease or injury, and that women are particularly vulnerable to these effects. Probably won't come as any surprise to you, but it's worth remembering that Toronto is one of the most expensive cities in North America, a pretty important fact. And it's not uncommon for people to work 2 or 3 minimum wage jobs just to maintain their household income. I know people in that circumstance, and I'm sure all of you know people in that circumstance as well. And about 1/4 of the city's residents are living in poverty. 1 in 5 are women. So this is a really, really important thing for us to be talking about. A recent study from the Canadian Centre for Policy Alternatives found that minimum wage jobs are increasing in Ontario. And these stats I had to hear a couple of times to make sure I got them right. Less than 20 years ago, 1 in 40 workers in Ontario was earning minimum wage. Today, it's 1 in 8. So we have work to do. Unstable work also causes greater stress, and that leads to mental health issues like depression, so it's really important that we find ways to address this. Ongoing advocacy for research and discussions like the ones we're having today with the Women's Exchange are critical to ensuring that those that are underemployed do not fall through the crack and are not part of that health gap. Women's Exchange, which is the group sponsoring the event today, is a women's health research, knowledge, translation, and exchange center based here at Women's College Hospital. We are pleased to say that we're funded by the Ministry of Health and Long-Term Care, so we're very thankful to that. And we also get some support from the CIHR's Strategy for Patient-Oriented Research. And our goal here at the Women's Exchange is really to improve the health and well-being of women and everyone in Ontario. So if you'd like more information about the Women's Exchange, we've got some pieces there that will be helpful to you. You'll find it on our website, and it's on your agenda as well. There's some links there that will be helpful. Now, I've also been asked as part of my role to do a little bit of housekeeping, and so to tell you a few things. So if you haven't already noticed, the washrooms are just up there behind the entrance. And there's also a gender-neutral washroom, which is located on the lower level. So you're welcome to find those. We also encourage today in particular that you use social media. And the hashtag WomensX is what we're using today to tag our posts. So please feel free to do that. If at any time today or as part of anything that you need, you have any questions or things that you need, please direct them to members of our Women's Exchange team. And I'd like members of the Planning Committee team to stand up. Robin Mason, who's our scientific lead for the Women's Exchange. Sigal Abdul, who's with us today. Thank you, Sigal. And Suzanne Day, who's outside. She's already busy, but you can find her as well. And they do an amazing job, so thank them for that, but also if you need anything, we're here to help you. Now, it's my real pleasure to introduce Anne Hayes, who is the Director of Research, Analysis, and Evaluation at the Ontario Ministry of Health and Long-Term Care. As I said, the ministry provides us with ongoing support, and we really appreciate everything that you do in support of this work and what you're doing for the health of women in the province. And we would like to invite you to provide some remarks. So welcome to Anne.
Thank you, Paula, and welcome to everyone. I'm thrilled to be here, and the ministry is very proud, actually, to be funding the Women's Exchange. Many of you will be aware of the great work that is done through the Women's Exchange, both in terms of the sex and gender analysis in research design and supporting the health research community in doing that. And also in the 15K challenge and the amazing projects that have resulted through that. I wanted to also highlight today a few perhaps encouraging signs from our government that in support of women and families and work. Just yesterday, in fact, the Minister of Labor announced a working group on gender pay gap. And so there's going to be a new effort to develop an action plan to address the issue of gender wage gap. I think that's a really important step forward. Also this week, the government announced further funding support for childcare spaces. There is a commitment over 5 years to increase childcare spaces by 100,000 spaces, and so the announcement this week was a step in towards that 100,000 space goal. In September of this year, the Secretary of Cabinet released a new policy for the Ontario Public Service, which is a respectful workplace policy. And this policy is designed to prevent discrimination and harassment in the workplace. And the whole of the OPS is involved right now in implementing it, including all the way through to all of our performance plans have to include the steps that we are all taking as individuals in the public service to fulfill this new policy. So I think we're living, at least this week, in a time of optimism for, support for women and families and work. So I'm really interested to hear today's discussion. I think it's a topic that we all feel both professionally and personally. And so with that, I'll just hand over to whoever's doing the next bit.